It's estimated that a third of Americans have some form of chronic pain. We don't really have good medications to treat it in the clinic. In fact, the side effects can be fairly dangerous.
An assistant professor of pharmaceutical sciences at Southern Illinois University Edwardsville, Bill Newman, is partnering with researchers at nearby St. Louis University to develop safer treatments for millions faced with chronic pain.
Chronic pain can run from mild and irritating to very severe, and it's a real quality of life issue. It interferes with sleep, it interferes with all activities of normal living. So clearly we need new medications that are more efficacious.
Many effective drug therapies prescribed in doses high enough to treat chronic pain also cause pain as a side effect. This forces doctors and patients to make difficult choices when considering the cost and benefits of effective treatment over increased risk and reduced quality of life. Funded by a grant from the National Institutes of Health, Dr. Newman is investigating how patients can be treated by targeting a naturally occurring chemical that causes pain.
Our team here at SIUE School of Pharmacy and our collaborators at St. Louis University, the School of Medicine, Daniela Salvemini, have been interested in reactive oxygen species in pain and inflammation for some time. And Daniela has really been the key person who has identified a toxic metabolite, peroxynitrite, that is overproduced in chronic pain states. Peroxynitrite is a very reactive species, and so it really interferes with the normal housekeeping, and when it's overproduced, your neurons are excited and are firing continuously, leading to chronic pain.
Newman and the SIUE graduate students that assist him in his state-of-the-art lab on the campus of SIUE began looking at using naturally occurring enzymes that destroy peroxynitrite as catalysts for treatment of chronic pain.
Our first goal was to take that framework, that scaffold, and make it into something that's more biocompatible in terms of being an oral drug. When we combine our catalysts with known pain drugs like selective COX-2 inhibitors, Celebrex, or even morphine in the opioid category, we see potent synergy. And that means we can give what you would consider to be subtherapeutic doses of Celebrex or of morphine, doses that are far below what would work normally and far below what would normally engender side effects, and yet they are rendered highly potent.
Newman and researchers have shown that these catalysts provide life-changing relief for breast cancer patients. Because of the neurotoxic nature of chemotherapy drugs used to fight cancer, some patients develop chronic neuropathic pain that can last for years.
Our compounds not only can prevent chemotherapy-induced neuropathy from typical chemo agents like Taxol, which is very commonly used for breast cancer, but we can actually reverse it once it's formed. And so again, that's something I think is very exciting, in that we could potentially dose these types of compounds along with chemotherapy to completely reduce this side effect.
To learn more about Dr. Newman and SIUE's other groundbreaking graduate faculty research and creative activities, visit siue.edu.